A Chinese delegation of medical specialists and a shipment of humanitarian aid has arrived in Venezuela. Meanwhile, a Cuban medical brigade of 39 health workers arrived in Andorra to help in the fight against the novel coronavirus. Brazil is now the Latin American country most affected by the novel coronavirus pandemic, while the situation in Ecuador is dramatic, with almost 2,000 confirmed cases. For the third day in a row, Spain reported over 800 new deaths due to the COVID-19 virus. From the headquarters of Teleso English in Havana, Cuba, this is From the South. I'm Katrina Goss. A Cuban medical brigade of 39 health workers arrived in Andorra on Sunday to help in the fight against the novel coronavirus. The medical help came as health authorities in Andorra reported over 330 cases and 6 deaths due to the COVID-19 outbreak. 12 doctors, 26 nurses and a logistics specialist will offer assistance and guidance on the pandemic in this independent principality located between France and Spain. Jorge Delgado Bostillo, director of Cuba's Central Medical Cooperation Unit, stressed that Andorra requested the Cuban medical aid in recognition of its prestigious public health system. On Sunday evening, the Cuban brigade was welcomed at the Madrid Barajas International Airport with spontaneous applause from airport workers, taxi drivers and people present at the terminal. This Monday, Venezuelan Foreign Minister Jorge Arreaza made public a letter sent by President Nicolas Maduro to international leaders and heads of states to denounce the attacks of Donald Trump's government against the Bolivarian Republic. The Venezuelan president recalled the recently uncovered plot to assassinate him, led by Cleaver Alcala and organised in Colombian territory with US support. The conspiracy also targeted the president's family members as well as other high-ranking officials. Maduro stressed that the frustrated plot was set to be undertaken in late March in the midst of the battle against the COVID-19 outbreak. During the pandemic, the US government has ignored international calls and reinforced the unilateral sanctions against Venezuela, which complicate access to medicines.
Venezuela will go on, firm. We continue fighting until now with good results against the COVID-19. We regret the losses of life and the cases that have resulted positive. We are giving them all the attention. No one is going to distract us from our will to protect the Venezuelan people. No one is going to get rid of President Maduro, no matter how much they attacked him psychologically and even physically. He will continue to work to protect the Venezuelan people and to promote peace in the world.
And we have more details on the arrival of the Chinese doctors in Venezuela, together with a third shipment of medical supplies in the following report.
This is the third flight to arrive to Venezuela from China, with medical supplies including gloves, masks, and thousands of COVID-19 quick detection kits. It also brought an extra component. 8 doctors specialize in respiratory diseases and traditional Chinese medicine to cooperate in prevention, treatment, and recovery together with Venezuelan doctors.
About 2 months, I deal with over 600 patients. No one died. So I and my colleagues have much experience to dealing with coronavirus 29. So we can have a communication, or we can share some experience with doctors, with the specialists.
Venezuela is the first Latin American country to receive a team of Chinese specialists, sealing a constant relationship of cooperation between the two countries, forged from the time of Commander Hugo Chavez and strengthened in these times of blockade against the Bolivarian Revolution.
China supports Venezuela and other countries in the world that need it. We do it with the same great love and joint efforts to promote the construction of a community of all humanity.
The large powers are great in the search for shared development, a premise of Chinese foreign policy. They are powerful in the search for peace. They do not promote war, blockades, or aggressions. And of course, that peace and shared development will happen when the powers have the moral greatness through solidarity, which we are witnessing today.
These are quick tests which already circulate in the Venezuelan health system, and in 15 minutes confirm or discard COVID-19. They're used in the massive and personalized diagnostic process that the doctors carry out when they suspect the disease due to symptoms or contact with confirmed cases.
Si tiene una, es negativo. Y si no marca la control y marca el T, la prueba es inválida.
According to the reported data, Venezuela has recorded the highest recovery rate in the region, linked to the low prevalence rate in relation to the population. This 25-year-old man is one of the people under evaluation to determine his final discharge after receiving the treatment guaranteed in one of the 46 hospitals enabled for COVID-19 cases.
I was one of the people who said that we didn't have that disease here in my country. And by failing to comply with the measures, look at what happened to me. To my Venezuelan people, I say follow the rules, be very careful and take care, because this is really bad. It was really awful.
All of the technical and medical cooperation is only sufficient if the collective quarantine and prevention practices to contain the propagation routes are followed. This continues to be the main call made by authorities.
Ecuador has reported almost 2,000 positive COVID-19 cases and 60 fatalities, to become one of the worst affected nations in South America. In Guayaquil, one of the most populated cities of Ecuador, a mass grave is being dug to bury the bodies of COVID-19 victims. According to local media, the grave will have a capacity for 300 bodies. Videos have gone viral on social media of families denouncing the fact that they don't know what to do with their relatives' bodies. The country remains in a state of emergency declared by President Lenin Moreno. The measure includes a national curfew from 2 p.m. to 5 a.m. local time. The health crisis has exposed the cracks in the Ecuadorian health system and a lack of response from the government. And our correspondent in Ecuador, Denise Herrera, brings us more details.
The cases of coronavirus are still increasing in Ecuador now. The Ecuadorian authorities reported that Ecuador has 1,962 cases of coronavirus and 60 deaths. I am at the Avenue de Asiris. This is one of the main avenues of Quito. As you can see, the buses are transporting passengers from Brazil. They will return to Brazil under this crisis. At the beginning of this crisis, the authorities of Ecuador said that they will help all the Ecuadorian citizens that travel to other countries. But now, the Minister of Government, Maria Paula Romo, said that they will suspend this humanitarian aid because all the Ecuadorian citizens are not responding and not respecting the measure of the quarantine. Also, recently, the citizens of the province of Guayas denounced that they don't know how to do or what to do with the dead bodies of their relatives. It is a really difficult moment for Ecuador. The authorities said that they are taking all the measures, but as you can see, and we can see in the social media, the citizens are still denouncing a really crisis in the province of Guayas.
Brazil is now the Latin American country most affected by the novel coronavirus pandemic, having reported over 4,200 cases and more than 130 deaths. Brazil ranks third among the worst affected countries of the American continent after the United States and Canada. Sao Paulo is the most affected state with almost 75% of positive cases. The country's health authorities have insisted on the importance of social isolation measures to contain the spread of the virus, a move which has seen varying levels of support from decision makers at different levels of government. On Sunday, President Jair Bolsonaro ignored his own health minister's call and hit the streets of Brazil's capital, declaring, "We all die one day." Some of the most distinguished members of the Brazilian left have demanded Jair Bolsonaro's resignation, criticising what they called his cynical and criminally irresponsible handling of the coronavirus crisis. Jamaica has reported its first health worker to test positive for COVID-19. Prime Minister Andrew Holness made the announcement on Twitter late on Sunday. The Caribbean island has now confirmed 36 cases of the novel coronavirus.
The biggest threat presently to our numbers spiking would be persons who returned to Jamaica within the last 14 days, specifically those who returned from the 18th of March to the 23rd of March. Those who have not kept themselves in quarantine and who are circulating in the population who could possibly be asymptomatic or symptomatic and are spreading the disease in the population.
The Ministry of Health of Belize confirmed the country's third case of COVID-19 as a 38-year-old man who had visited New York City. The Director of Health Services provided a statement on the case.
The patient was swabbed on March 27th, and today the screening and confirmatory tests have confirmed that he is positive for COVID-19. That patient remains in self-isolation, and the Ministry of Health surveillance team has been activated and alerted to start conducting their mapping exercise.
And St. Lucia has reported a total of 9 confirmed COVID-19 cases. Among those diagnosed positive are St. Lucians who travelled to New York, Barbados and Dominica. Like other nations, St. Lucia has anticipated interruptions in regular shipment of testing supplies and is therefore calling on the public to continue following the recommended measures to avoid infection. Meanwhile, a contingent of 113 Cuban medical professionals arrived in St. Lucia on Friday to strengthen the national capacity to provide care during the coronavirus pandemic. The professionals are currently undergoing a 14-day quarantine period prior to commencement of their duties. The government of Grenada is to enforce a 7-day total lockdown with a 24-hour curfew from Monday night. The strict lockdown comes after the population failed to observe measures already imposed to try to slow the spread of the novel coronavirus, according to Health Minister Nicholas Steele. The Caribbean nation has so far reported 9 confirmed COVID-19 cases.
As a result of the inability of some of us to follow the guidelines designed to keep you safe, the government is now revisiting the measures from last week, with a view to escalating them. This will give our medical authorities the necessary mechanism to contain the very real possibility of a community spread of this COVID-19 virus. It will also ensure that there is proper maintenance of supplies and services.
More stories coming up after this very short break, so stay with us. Welcome back. The United States tops the list of nations with the most confirmed COVID-19 cases in the world. The number of confirmed coronavirus cases in the US now exceeds 150,000, according to the latest figures by Johns Hopkins University. Over 2,800 people have already been killed by the disease across the country. As of Monday morning, New York remained the worst affected state, with about 60,000 positive cases. President Donald Trump on Sunday backtracked from his earlier statements, expressing his confidence that the country would be back to normal by Easter, and extended the federal guidelines urging social distancing through April 30th, citing figures from his advisors that showed that as many as 200,000 people could die from the virus if the country took the most aggressive action to slow its spread. For the third day in a row, Spain registered over 800 new deaths due to COVID-19, according to data released by the Spanish Health Ministry on Monday. Spain overtook China in terms of the number of confirmed coronavirus cases to join Italy and the United States in reporting over 85,000 infections. At midday on Monday, a minute's silence was held in a central Madrid square for the victims. The news came as Spain put into effect tighter lockdown measures approved during an extraordinary cabinet meeting on Sunday and announced by Prime Minister Pedro Sánchez. All non-essential workers are being confined to their homes from Monday until April 9th. And Spain's health emergency chief, Fernando Simón, has tested positive for the novel coronavirus. It was confirmed on Monday. In the meantime, health official Maria José Sierra will replace Simón as head of Spain's Centre for Health Emergencies. Sierra stressed that over 12,000 Spanish health workers had tested positive for COVID-19, equivalent to around 14% of the country's confirmed cases. The normally bustling streets of the Russian capital were deserted on Monday as the government ordered a lockdown of Moscow. With the country's coronavirus cases topping 1,800, the Russian government is overseeing efforts to combat the outbreak. Over 1,000 of the confirmed cases are located in the capital, and Moscow officials have reported that a sizable portion of the patients are young people aged between 18 and 40. Russia's confirmed COVID-19 cases have risen by more than 300 since Sunday, while 9 people have died. The number of confirmed COVID-19 cases around the world has topped 700,000, with 400,000 located in Europe, where the majority of fatalities have also been confirmed. The pandemic has spread to 202 countries and regions globally, according to the latest figures from the World Health Organization. The coronavirus has claimed 10,779 lives in lockdown Italy by Sunday, while over 97,500 cases have been reported, with over 5,000 confirmed in the past day, according to data from the country's Civil Protection Department. Meanwhile, 2,599 people have been infected in France and 292 have died. A total of 19,522 COVID-19 cases had been confirmed in the United Kingdom as of Sunday morning, marking an increase of over 2,000 over 24 hours, according to the Department of Health and Social Care. The head of the World Health Organization on Monday urged G20 countries to pull together to address a chronic shortage of personal protective equipment and medical supplies as the novel coronavirus continues to spread.
Earlier today, I spoke to trade ministers from the G20 countries about ways to address the chronic shortage of personal protective equipment and other essential medical supplies. We call on countries to work with companies to increase production, to ensure the free movement of essential health products, and to ensure equitable distribution of those products based on need. COVID-19 is reminding us how vulnerable we are, how connected we are, and how dependent we are on each other. In the eye of a storm like COVID, scientific and public health tools are essential, but so are humility and kindness. With solidarity, humility, and assuming the best of each other, we can and we will overcome this together.
Zimbabwean authorities began enforcing a 3-week lockdown on Monday as part of the fight against the spread of the novel coronavirus. The virus has left 1 person dead in the African nation, while 6 others have been infected. President Emerson Mnangagwa declared a 21-day total lockdown starting on Monday, banning movement within the country, shutting most shops and suspending flights in and out of Zimbabwe. Police mounted checkpoints on routes leading to Harare's central business district, stopping cars and turning away pedestrians who had no authorization to be in the area. Elsewhere, truckloads of Metropolitan and National Police were deployed to order people back to their homes. The Arab League has called on international organizations to openly expose the racist policies and crimes of the Israeli regime against the Palestinian people. On Sunday, the Arab League denounced Israel's violations of Palestinian rights and the basic principles of international law, as well as the resolutions of the United Nations on continuing to build illegal settlements in the occupied Palestinian territories. After reiterating its full support for the Palestinian people in their fight against Israel, the Pan-Arab bloc insisted on the need to create an independent Palestinian state with the city of Jerusalem as its capital. In what has become a popular initiative across the world, every evening at 9 o'clock, Cubans take to their balconies and windows to applaud the health workers undertaking the daily mission of saving lives. Videos are posted across social media to encourage more people to participate. And speaking of social media, don't forget to follow us on Facebook, Twitter and Instagram. For Telesur English, I'm Katrina Goss, and we finish with some of these emotive images from Cuba. Enjoy and thank you for watching.
Vamos, caballero, aplaudirle a los médicos.